Colleges and universities across the region test students and staff for COVID often twice a week for asymptomatic tracing. But a hospital executive tells me they simply do not have the resources to do the same for their doctors and nurses. As COVID hospitalizations soar, Dr. Otis Warren, the state's head of the American College of Emergency Physicians, says healthcare providers are increasingly more exposed to the virus.
Every day I go into work and I see COVID patients. I look in their mouths, I touch them. Occasionally I put breathing tubes in their trachea.
Yet Dr. Warren and anyone else in his position aren't getting tested by hospitals unless they show symptoms.
We at all the health systems are strapped with availability of testing.
Dr. James Finale, Care New England president and CEO, says the major issue is hospitals simply cannot compete with the higher price point colleges, even the NFL, are willing to pay per test.
It's a statement of fact. There are only so many tests, and if I were in business, I'm going to sell my test to the highest bidder.
Finale blames the federal government for the lack of testing supplies at hospitals.
That, to me, is the one Achilles heel of this whole issue and needed to be addressed on the federal level months and months ago, and it wasn't.
There's another more complicated problem, says Dr. Warren. If hospitals were able to conduct asymptomatic testing, they would undoubtedly find positive cases.
And those people will then have to be out of work for 2 weeks or so. And that could really decimate the workforce of a already kind of strained system.
Warren says doctor-to-patient transmission in hospitals is rare because masks and PPE work. A Department of Health spokesperson says while staff testing isn't happening in hospitals, healthcare workers can sign up for testing through the state's online portal. With the Target 12 investigators, Tim White, 12 News. One hospital executive tells me it comes down to money. He says they simply cannot compete with prices colleges and universities, as well as other institutions, are willing to pay for regular testing. This chart on WPRI.com's Track Cases page shows a concerning trend. COVID-19 hospitalizations are again on a steep rise, meaning frontline healthcare workers are coming into close contact more frequently with infected patients.
Yet we in the hospitals are not getting screened.
Dr. Otis Warren, the state's head of the American College of Emergency Physicians, says there is a risk to asymptomatic testing of doctors and nurses. Finding positive cases would lead to quarantines and an even worse staffing shortage.
Personally, I would love to get tested asymptomatically, but I understand, my personal needs and the needs of the healthcare system are not necessarily aligned.
The colleges, universities, sports teams, they're all buying testing and we're competing with them to get it. Obviously, we don't have the coffers to be able to pay extraordinary costs.
Dr. James Finale, president and CEO of Care New England, says the federal government should have addressed this crisis months ago and didn't.
That, to me, is the one Achilles heel of this whole issue.
Warren says even though they are somewhat in the dark when it comes to hospital staff who may have the virus, the chance of doctor-to-patient transmission in a hospital setting is small.
And I think that is kind of the testament to how well masks particularly, but generally other protective measures work.
A spokesperson at Lifespan, which owns Rhode Island, Hasbro, and Newport hospitals, tells me Lifespan does not provide testing for asymptomatic employees since there is a very limited supply of COVID-19 test kits, and we are trying to conserve them to ensure we have enough for patient care. Hospital staff who show symptoms are tested for the virus. With the Target 12 investigators, Tim White, 12 News.